back with Dr. Kevin Kavanagh. He is a retired physician. He is also the founder of a national organization that is even becoming, to a degree, international, called Health Watch USA. When you started this, how many years ago, Dr. K?
Well, over 15 years ago. Been a long time.
Did you ever dream that it would grow like this?
No, I haven't. In fact, I was just this morning communicating with 4 infectious disease authorities internationally, one from Kenya, Singapore, Germany. You know, it is really something to be able to compare what's going on here versus what's going on in other countries. And big topic is always misinformation, and they're very concerned about foreign interference and discouraging people from getting vaccines. And a lot of this can be traced back to our foreign competitor websites, which is unfortunate, but we've got a tough battle ahead of us.
Let's start with vaccine coverage. Is it waning?
Definitely waning. The Wall Street Journal just reported the White House is thinking of now requiring boosters after 6 months. It doesn't mean that it's not good. It still gives you a good armor of protection against getting severely sick, for example, in the ICU or dying, so you want to get vaccinated. But when you talk about, hey, I'm free to do anything I want to do, it's just like before, that's not the case. You're still at significant risk of getting a breakthrough infection. You can still spread the virus, and both myself and I think you've got a friend too, Jack, that have been sickened by the coronavirus even though they were fully vaccinated. And mine is very sick. So it's problematic. You still need to take precautions.
Boosters, do they work, and when will they be available?
I'm not sure when they're going to be available. The short-term data that we're getting, both laboratory and clinical from Israel, is that they do work. The laboratory data shows they may boost your immunity by 9 times. Of course, they've only followed people in Israel for about a month or even 10 days, but again, they showed significant less hospitalizations in that group, 5 to 6 times less hospitalizations and serious illness. So that is good, and it is something we should get. Now, I must tell you, I'm a little disappointed because like with the flu vaccine, every year you have a new formulation. Somehow we still have last year's shot, and I do think they're working on a new formulation for new variants, which will be coming down the line. So they do work. You do want to get them when they become available, but I would certainly talk to your doctor regarding the exact timing of a booster.
All right, let's go to the phones. Mike is with us. Good morning, Mike.
What I wanted to say was, I know 3 or 4 people that work like as nurses and nurses' aides and stuff like that in the hospital. And everyone I talk to, they're telling me the majority of the people coming into the hospitals right now that are getting real sick are people that have been vaccinated. But on the news, they're reporting the opposite.
I do believe the majority of those individuals coming into the hospitals right now are unvaccinated. On the news last night, the data that I saw was from University of Kentucky, their hospitalizations, 79 were vaccinated, and that was out of 441. The rest were unvaccinated. And so that does show you do have some breakthrough, especially if you're over the age of 60 and you're more than 5 to 6 months post-vaccination, you're at risk for hospitalizations. But those are usually not the people that are put on the ventilator or that are dying. So the vaccines aren't perfect. They give you a layer of protection, and that's what's important. Believe me, I've been fully vaccinated. When a booster's available, I will be first in line to get that because the data shows they work, but they're not 100%.
Looks like the governor must be listening to you. I noticed that he's wearing like a KN95 mask these days.
That's what it looks like the last picture I saw. Now, I'm not sure of that, but it definitely was a very upgraded cloth mask. It looked like a KN95. And I think that with the Delta variant, as I stated, we all need to upgrade our precautions and our masking. Remember, this variant spreads 1,000 times more viruses than the previous variant.
There's so many things involved with this whole pandemic and information, and there's been information out that they've learned later was misinformation. So a lot of confusion, and this is one area that I think there's confusion right now. If you had, just for the sake of conversation, Dr. Kavanagh, the Moderna 2 vaccinations, do you have to wait for the Moderna booster to come out, or can you have the J&J or the Pfizer?
Well, right now they're recommending that you get the same vaccine you had before, but there's active research on that. I should add that the Moderna has over 3 times the mRNA in its formulation than the Pfizer, so it gives a little bit better protection according to the Mayo study that was just published. So right now I would stick with the same vaccine. Now the J&J vaccine, some people are recommending switching to the mRNA, but that's going to change as research is coming out on that. There are some studies, and one was presented at our conference back in June, that shows if you switch formulations or if you switch vaccine types, you may actually get better immunity. So a lot of that just isn't known. For me, I'm going to stick with the same type and take kind of the safe course on that.
All right, let's go to Dr. Border over at St. Joe. Good morning, doctor.
This is Jim Borders. I'm CMO at Baptist, but I was going to tell you that
sorry about that.
Well, it's all right. The 9 hospital system in Baptist published our statistics on unvaccinated patients admitted, and yesterday, system-wide of the 9 hospitals, approximately 86% of those admitted with COVID were unvaccinated. In our ICUs across the system, across the state, 95% precisely were unvaccinated, and there was 1 unvaccinated on a ventilator. But you have to keep in mind, as Dr. Kavanagh, I'm sure, will detail, that many of these people, though vaccinated and greatly protected, also have immune problems, and so in which all vaccines have less effectiveness. So that's quite a bit of statistical value for the vaccines, despite the kind of population that sometimes responds less well to a vaccine than someone who has excellent health going into getting vaccinated.
Kevin, you have comment?
Well, and that's what they're seeing nationwide, is that overall, the New York Times reported that between 12 to about 24% of individuals that are hospitalized are vaccinated versus unvaccinated. And that will vary depending upon the rates of vaccination in the state. In other words, the higher the vaccination rate, the greater the percentage of vaccinated people. And as the caller said, most are immunocompromised. I think that is about a third. Another big category are those people like myself that are elderly, where your vaccination timing fell 5 to 6 months or greater from where you are today. So in other words, the vaccines are starting to wane. Those are the 2 big categories. If you're young and you just got vaccinated, you're going to be highly protected. Or if you're vaccinated 2 to 3 months ago, again, highly protected with this variant, at least regarding hospitalizations. Again, you still may get infections. If you look at protection from symptomatic infections, the Mayo Clinic study, I believe, was around 42%, and also the Israeli data fell within that category. And that's overall, meaning that if you're vaccinated recently and younger, you're going to have a much greater protection than if you're vaccinated far out and you're older. So, yes, they do protect, but they're not 100%.
Dr. Borders, thank you very much for your call, sir. Let's go to Joe. Good morning, Joe.
Hey, good morning. How you doing?
Good.
So I'm just curious. Has anybody mentioned about? Has there been any talk about the graphene oxide that's been found in the vaccines?
Absolutely not, because that's misinformation. Okay, graphene oxide is not in mRNA vaccines. I tell you, just this morning, as I said, I was talking to one of our experts in one of the foreign countries, and he's very prominent in saying he can't convince his 82-year-old mother to get vaccinated because she's watching all this misinformation, which he traced, he says, to a foreign adversaries website. And again, it spews all of this stuff. This is a serious event, and our adversaries are trying to take advantage of us, and they are spreading misinformation. Many of the roots of this go back to foreign intelligence websites. And I know that may be hard to a lot of people to grasp. But right now we are in a weakened state, and our adversaries are trying to throw fuel on the fire. So no, the vaccines are very effective. If you can look at the ingredients for mRNA vaccines, very few things are in that. There's not even any adjuvants.
Okay, we got a real nasty line this morning with Laura. Go ahead.
Okay, I am so sorry about the phone. Listen, group health insurance policies get renewed every 6 months, so we're just at the beginning of statistics for them to raise rates where people are costing them more by going into the hospital. I understand Delta is charging their unvaccinated people an extra $200 a month. Do you have any information on how that's affecting people deciding to get vaccinated if they have health insurance through work?
Okay, thanks, Laura.
I don't have any information, but I have heard that unvaccinated are going to be looking at paying higher rates in health insurance. I also think that, Kentucky is going to either have to start somehow enforcing vaccinations, or we're going to be at a competitive disadvantage. When industry moves into an area, they look at vaccination rates, they look at COVID rates, they sometimes send in secret shoppers to look at whether or not people are wearing masks. So, we need to get our act together as far as following public health advice and getting this virus contained. It is of utmost importance.
You say that New York is underreporting, and also other states probably doing this also. Why are they doing that?
Well, because the leaders are under pressure in many areas of why things are not going well. And so the reports tend not to be really as accurate as they should be. And this is something that's really characteristic of all pandemics. In fact, in 2019, I wrote an op-ed regarding the type of misinformation underreporting in pandemics, and that was before COVID-19, and that's characteristic of many nations in many types of pandemics, and we're starting to see this now. If you go online and go to, for example, Worldometer or the Johns Hopkins site and look at Florida data, they've just, they petered out. Things are kind of late coming in. They'll eventually get there, but it's very haphazard. Right now, states are reporting sometimes just every couple of days, so that you have to backtrack on the data, and everybody's on a different schedule. So it's very difficult to keep all the cases tallied. So it's getting harder and harder to keep an accurate count. And overall, this is resulting in underreporting, which is, I think, very unfortunate.
I understand that China states, anyway, that they're Delta-free after using draconian measures to, things like lockdowns and repeatedly testing everyone in the cities. Do you believe that information?
Well, I'm not sure whether it's true or not, but if it is, they're the only one that's been able to successfully contain Delta. So I think we're going to watch that quite closely, because right now we're doing a mitigation strategy, which I don't think is going to be successful with Delta. We may have to switch to more an elimination strategy. And remember, herd immunity may only be strain specific, so that if we get hit with another variant, we may go through this again. So we really do need to change the way that we're living. And I think that's of utmost importance, and we need to look at vaccines as a layer of armor. We don't need to look at vaccines as a cure-all and that you can go out and live your life normally. Just today, the U.S. Surgeon General, and this is regarding schools, stated that to keep children safe, you need to wear properly fitted masks, properly ventilated buildings, and regular testing. And that's something we've been saying all along, and something our schools need to start gearing up to do, because a lot of our cases, I believe a third of them, are in children. They can spread it to other people, and unfortunately, we don't have the infrastructure for children getting sick as we do for adults. We don't have a large number of pediatric ICU beds. So although they may rarely get sick or get sick rarer, these children will have less resources to go to. So we really do need to protect our children and make sure they're not vectors to spread this virus.
Talk about the flu plus COVID-19 vaccination.
Well, currently, from what I am hearing, and I had talked recently with the health department, in fact, just yesterday, that the CDC is recommending that you can use the COVID-19 vaccination with any other vaccination. In other words, give it at the same time. Several months ago, that was not the case. It was a 2-week separation between vaccinations. That may change as more data comes in, so I would always talk to your doctor before proceeding with any sort of intervention or decision regarding vaccinations.
Excuse me, is it your opinion that we in the future will be getting a COVID shot once a year or more often like we do flu shots?
I think that that's probably going to be the case. The current booster that we're getting may actually last longer than the last one because it's spaced out more and your immunity may develop even a longer memory. But what concerns me is the emergence of these variants. They can cause breakthrough infections, as we're seeing now with the Delta variant, and they can also cause hospitalizations, as pointed out, mainly in those that are immunosuppressed or in elderly or where the vaccine is waning. In other words, you've been several months, 5 or more months out from vaccination. So I think that we're going to be seeing boosters, but I would like to see a reformulated booster to some of the more problematic variants rather than using a booster from last year's virus, which is one of the reasons why I would really recommend people talk to their doctor regarding boosters and just don't rush out and get one, because if you didn't need one right away, you weren't at risk. And then 2 months from now, they had a reformulated booster that covered current variants or the variant which they're expecting over Christmas. I think you may put yourself at a loss or disadvantage. So always consult your doctor regarding this issue.
Dr. Kevin Kavanagh, thank you so much. I hope you have a great weekend.
All right. Thank you, Jack.